Hello, everyone. It's Dr. 𝗘𝗽𝗶𝗀𝗺 from Virginia. Today, we have a very special guest. As I posted on X and LinkedIn almost a week ago, we have Dr. Asim Elahi. He's the program director at STH Consortium in McAllen, Texas. And I have known him for a while, but I think almost 1 month ago, he uh, posted about the communication, how to communicate program leadership on social media. And I have never seen such a good post. It was comprehensive, it was to the point, and I asked his permission. I shared on Twitter. We even shared on Apna YPC page. And from there, I started my contact with him, and he has been very gracious. And on Sunday morning, he has found some time for us. Welcome, Dr. Elahi. Thanks a lot for
Thank,
joining us.
thank you.
So, can you tell us a little bit about your program?
Okay, I'm going to start with myself a little bit.
Yep.
My name is Dr. Asim Elahi. I'm the program director for South Texas Health GME Consortium Internal Medicine Program. I have more than 7, 8 years of GME experience. Worked with resident throughout my career here in USA. Our program here is brand new. We have just started last year. Our first year is already running, 20 resident per class. So it's going to be 60 resident in 3 years. Mostly we have IMGs, but we do have some AMGs. I know everybody's interested in that ratio. Uh, but like we on ACGME a website, when we declared we wanted to have a diverse population of resident, and that's what we're gonna target to do this year too.
That's awesome. So, right now, you have the first batch of residents, so you have your intern class.
Yes,
Okay, and this year you are interviewing for your second class.
yes.
Okay, and 20, it's I would say for even for internal medicine, it's a very good number. Not many program has more than 20 per year.
Yeah, it's a big program.
Okay,
60
all right.
residents, big program.
Absolutely, absolutely. Okay, so with your permission, I would wear my applicant hat, which I think I have been wearing for a long time now. So, and when I posted about our podcast, many people reached out to me via Twitter, via personal messages, via LinkedIn, and they have sent a lot of questions. So, with your permission, is it okay if I start asking some of those questions?
Sure, happy to help.
Thank you. So we'll start with, of course, the common questions. For internal medicine in your program, is there like a soft or hard cutoff for scores?
No,
Okay,
I'll make it simple. No.
okay, that's very good. Uh, any cutoff for year of graduation?
We do prefer 5 year,
Okay.
but I have people who are with us who are graduated more than 10 years ago
Oh
too.
wow, that's awesome. And what about if someone has an attempt?
That is considered not an absolute no,
Okay,
uh, as long as they are able to explain.
I understand. Okay, absolutely. Okay, all right. Uh, The second question, again, in terms of scores, so you said that there is no cutoff. Again, and I understand that I always feel because when I took the exams, my step one score was below average, my CK score was above average, so I wasn't like in the top tier, never was. So I always ask this question: in your opinion, what would be, and now these days, especially when people are scoring very highly, uh, just keeping everything apart, in your opinion, what would be a good score? We will just talk about CK because, of course, step one is pass fail. A good score, in your opinion, when someone is applying to internal medicine, a reasonable score.
So it's I'm going to talk about just my self. When I see 240, I see, hey, this looks like a decent score.
Okay,
Good score, maybe I've seen 260s, 270s,
okay,
but above 240, that you got the tick mark there.
okay. I understand. All right. A lot of people ask about personal statement, that because internal medicine there are so many applicants and there are so many spots, so maybe the personal statement does not carry that much weightage when you are applying to internal medicine or family medicine. So what's your opinion about that?
I think it's very important. The way you write it, draft it. I've read so many, and like whenever I'm interviewing, that's the first thing I read. Even before the LORs, that's the thing I'm gonna definitely go over, and I will ask questions regarding whatever you have written. And if sometimes you cannot justify what you have written there, that's like a red flag. And
Oh,
that's very common to see people writing stuff or words they don't know the meaning.
okay. Okay, that makes a lot of
Yeah.
sense. So what you're saying is that whatever you write on your personal statement, uh, you should stand by it. So you should know what you are talking about.
Yes. Yes.
Okay.
And again, I mean, it's a big topic to discuss, maybe some other day. Most of the person statement I've seen from my part of the world. I'm from Pakistan originally. They revolve around family situations. Okay, this happened, this happened. So it's so common that it does not leave an impact on the person who's reading it. It is everybody has somebody who died in their family and then they became doctors. I agree. That's one of the factor you became a doctor. Probably one of my reason to be a doctor was that too. But it's a personal statement to impress. If you see that in every personal statement, it has to be a little bit unique.
Absolutely, I understand what you're saying, and that makes a lot of sense. Whenever I share my thoughts with the mentees and applicants, I always say that it just look at the words. So it should be personal and it should make a statement about you. So I think that's exactly what I would say, that what I have been seeing over the years is that it's not very personal and it also is not making a lot of statement about the person. Okay. All right. So you can, and is it like a confidential data, or you can share how many applications did you receive last time for 20 applicants?
I can share, but we didn't go into match
Yes,
because we
yes.
got accredited late. In matter of maybe 1 week, we got 2,000
Oh,
applicants
oh my goodness.
on our email, which was flooded, and
Wow.
it was very difficult to go
Okay.
through all of them.
Okay. So for I think this year you may be expecting anything from 3, 4,000 applications easily.
Yes, we are expecting four or
Okay.
5,000, and then we are expected to do 400 interviews.
Wow. So
Yeah.
Dr. Lai, how would that process revolve? So of course you are the PD, you have a whole team. So how would you do that? Any approximate I answer that you can give us?
So mostly, if you apply those filters, uh, as I said, less than 5 years, above 240, no attempts, and you distribute it to your associate program directors and core faculty, all those, and they go through those applicants, and then we'll come up with like 400 or like maybe 300 to 400 applicants, and then we'll interview them
Oh,
based on that. Yeah.
I understand. All right. So my question is that there has been a lot of talk about US clinical experience. When you are looking an application, how important is for an applicant for an IMG, especially because of course AMGs, MDs, DOs, they are different, their clerkships are here, even Caribbean, but for non-US IMGs, how much important is US clinical experience?
I think it's very important, but the more important thing is what kind of experience it is. Most of the experiences which I see, because again, as I said, like 7, 8 years I've been dealing with this. They will write things that I rotated there, but they don't have any knowledge of actual what's going on in the hospital setting.
Mhm.
So it's just shadowing somebody in the clinic. It will get you an LOR, but will not get you the US clinical experience.
Hmm.
So to me, it's my personal opinion. If I see somebody who has done some fellowship or post-graduation training back home,
Hmm.
and I see somebody who had done a clinical outpatient rotation, which we all know nowadays is paid too. You pay them
Hmm.
certain amount of money for certain amount of weeks, and you get an LOR and some experience to write on your. To me, that person who has done a post-graduation from their country supersedes. Again, I will filter them. I will ask all the relevant questions during the interview
Hmm.
just to make sure that this is legit. Because for us, there's no way to find out if they actually did that
Hmm.
fellowship back home or it is just like something on paper. But you can tell while you talk.
Yes, yes, of course. If someone is doing training, I think that a seasoned person, especially like yourself, I think it's not very difficult to assess whether that person has done it or not.
So the short answer is it's important, but it's more important where you have done it. If it's an in-person,
Hmm.
inpatient setting, and so the whole point of getting a US experience is like how the system works. It's not about how you're going to treat the patient. That part we're going to teach you, or you have already got it
Hmm.
from your medical school. It's like how the system works, how to deal with the other subspecialties, case managers, interdisciplinary rounds and nursing staff. There's so many moving pieces which you
Hmm.
have no idea when you come in. So if you show me that you have done it and I have asked you questions,
Hmm.
not a medical question, like an experience about your how you did well in interdisciplinary round, and you're unable to answer that, that's a red flag.
I understand. I totally understand. Now, since of course you know that they made this, they stopped taking CS exam. So a lot of people, IMGs, non-US IMGs, CS was the main reason they were getting the visas. So now it's gone. So most people would try to get ECFMD certified, then apply for step three or observership and try to get visa. So what I have seen that it is getting more and more difficult to get visa and to have US experience. I have seen some people like they have really good, even CK score in 260. Uh, they have good experience from, let's say, I know more people from Pakistan. Now, if someone like that applies with no US experience, some good, let's say, house job experience from Pakistan, and a very maybe 1 year of graduation or two, and good personal statement, good personalized, waived LOR from Pakistan, do you think that is someone you can consider offering an interview?
Yeah, for me, it's a strong candidate.
Okay.
They have good research, some publications from a good institute.
Hmm.
Yes, waived LORs. Yeah, they are very strong candidate.
Okay, I understand. And now that you have mentioned research, how important is research when you are evaluating an application?
Yeah, I think it's very important. I usually want all 20s to have like some publications,
Hmm.
but at least 90% of the people I will select should have some good publications. Reason being is we all know ACGME is looking for publications from the like faculty.
Hmm.
And faculty sometimes don't have time. And if you don't have residents who have good publication or who can actually publish,
Hmm.
it becomes very difficult for a program to sustain that publication status.
Absolutely,
So
absolutely,
that's like a need now for all the programs. So if
absolutely.
somebody is thinking that they want to get into the system without publications, it's not going to be easy.
I understand. Okay, the next question is about step three. What's your take on step three? If IMGs have that in application, does that make them any, give them any advantage?
Step three for me, again, it's my opinion, it's it's a must. If you're an IMG, you should take it. Unless you just graduated
Hmm.
from med school and you're looking lucky enough to get an interview and you're doing an interview and you say, hey, doc, I will do it next month. That's a different story. But most of the IMGs I look at, especially from our part of the world,
Hmm.
they should have step three. Otherwise, like a kind of a red flag that as we know here, like in American medical graduates, they usually do steps while they're in med school.
Yes.
On the other hand, some of our folks, they do it after medical school or in the final year, but then they have ample time to do step three. If you don't do step three, to me, it looks like you're like a little bit behind.
I understand. Okay. All right. Uh, the next question is about signaling. This year they have increased the signal. So they have like 12, I think, 12 say silver and 3 golden for internal medicine. Even for psych, they have gone up to 10. And I have asked this question to a lot of people, the program directors, and they have different takes. What's your take on signaling?
I, I think it's not gonna change a lot. It's as you know, it's like selection is like there's so many people to select from. Even
Hmm.
if you get signals from a couple of people, you still have a lot of people to choose from.
Sure.
I think we are still at in a position to choose a lot of good applicants.
Mhm.
I'm like surprised. Today I got a message on LinkedIn. Somebody said I'm gonna do a golden signal, and they were asking how much weightage it. I didn't even know what to answer.
Yeah, yeah, no, I understand. Okay, yeah. So basically, I think my question about signaling would be that let's say that two relatively similar applicants, which let's say IMGs, and one have signaled you and one have not. So would that make any difference?
It's a difficult question. Yes, I would say yes if I like both of them and one of them signal me. Yes, that should make a difference. Yes.
I understand. Yeah, that makes a lot of sense. Uh, so, Dr. Elahi, does your program offer visa?
So far, no,
Okay, all right.
but we are working on it. Maybe in future, couple of years. Yes, we will.
Okay. And the reason I asked this question because that has also been what I have seen is that more and more programs are even the programs that have sponsored in the past, they are stepping away from it. And one of the reasons which I have seen, as a matter of fact, I also went through that process, is that there has been a lot of refusals as well. There has been a lot of administrative processing cases. Like you interview, uh, I mean, I cannot name the places which I know that they had out of eight, let's say three IMGs and two of them got stuck. So what's your take on that overall situation that how difficult it is getting for visa requiring IMGs?
I think I totally agree with you. That's the issue right now. Unfortunately, especially with newer programs, it's very difficult to get like somebody on visa and they don't come
Absolutely.
because you need to fill that spot. You get like 3 years to fill those spots to get that all the bundled payments you get. So it's kind of a corporate issue. And most of the programs, people start saying, "Hey, why you not visa applying visa?" It's not like the program director. It's like a higher up the
Oh yeah,
CM.
absolutely. Yeah.
Yeah. So and I've seen, I can't name those programs. Actually, I was part of those programs. People did not show up, and it's really difficult to handle that situation. You
Absolutely.
have to wait certain amount of months, and sometimes you have to do a waiver with them to give them a spot next year so that you can hire somebody that year. It's not easy, and
Absolutely.
you will be resident free for 3 months at least before all this process can be done. And busier programs who only depend on residents, it's really difficult.
Yes. No, I totally agree. So my when I visited Pakistan in the beginning of my third year of residency, my visa was placed under processing. I was there for 3 months. And then once I finished my residency, I joined Karelia and I signed it. I was supposed to start in September. I went to Pakistan and it was again placed. And so they had to hire locums and they had to pay a lot.
Yes. Yes.
Yeah, I can't even imagine how difficult it is for the programs. Being on other side of the table now, it's very difficult. It's very difficult. Dr. Lahi, uh, uh, something which I personally feel that it's very important in the ERAS application, I wanted to ask you, what do you think is the significance of ERAS picture?
I think it's very important. It has to be professional.
Mhm.
Most of the pictures I've seen, they are good. People try to do well,
Mhm.
but I've seen like some unprofessional pictures, and that's a red flag right away. It's just like you presented without a tie on an interview.
No, absolutely,
Yeah.
absolutely. Totally understandable. So, Dr. Lahi, at this point, does your program offer any fellowship or in the there is any plan to start fellowships?
Yes, we are planning so within 2 years, because you have to have 2 years of internal medicine before you can apply for
Mhm.
residency. We are almost ready with cardiology and GI.
Oh,
That's the
wow.
first two we'll be starting. Yeah.
Wow, because these are perhaps two of the most competitive ones.
Was, yeah. And we have like a big population which is really needing these two specialties. So these decisions are based on what is needed in the valley.
Okay.
So cardiology and GI was the first one which was needed.
Mhm.
Pulmonary critical care will be the next one, but
Okay.
these two are the first in the list.
Okay. So, Dr. Lahi, when you select 400, let's say you select 400 people for interview, and then of course interview performance. Now, when you are making the rank order list, would it be entirely dependent on the interview performance, or would you also take some of the other factors like score, step three into account when making a list?
So we have an Excel sheet. We put like everything on that Excel sheet. We score it. So we have given like scores to different things. Like
Mhm.
if you, for example, if you failed, there's -10. If you did great, there's +10. And of course, at the end, this interview will be at least with three faculty people. So everyone will score based on your appearance, your medical knowledge, your communication skills. All those are rated differently, scores from 1 to 10, and then we aggregate it. And then the final committee, selection committee sits and talk about every candidate. Last year, that's what how we did. We spent like 2 days just talking about each and every candidate individually. So everything is brought up. Like for example, one of the candidate, I'm just gonna give you example. I mean, no names here.
Mhm.
Was not well dressed and were very casual in the way interviewed. And I noted that, like when I was interviewing, I noted that in that Excel sheet that very casual, not well dressed. And because you will not, you'll forget it. Like, but when we started discussing, that was brought up, and everybody said, "Yeah, you're right." Because then these are just like we look for red flags. We don't look for green flags when we are
Mhm.
selecting, because these
Exactly.
are the people who will be working with you for next 3 years, and it's a stressful environment. You know,
Mhm.
you don't want people to break easily. You don't want people who will be too casual and not take
Mhm.
care of the patients. So one red flag, you're out.
Okay. Totally understandable. And I think that's what when I was doing residency, that's what I got from my leadership and even here is that when you are interviewing patient, you are basically thinking about that that person would be working with you, let's say in the clinic, on inpatient floor, or doing a call with you. So try to imagine that whether that patient, that applicant would suffice the criteria. So yeah, that's very important.
I just want to add something. Like this all conversation reminded me, like one of the interview a couple of years before another institute, like the applicant was not very professional with the coordinator who are on the Zoom, just saying like casual question, what's the hold up? So that could be a normal thing if you're talking to your friends, but
Mm.
if you're in an interview and you're trying to be cool, saying what's the hold up, the program manager or coordinator may not like it, and she held it against him, and she mentioned to every single person who was about to interview that this person does not look to me very professional.
Yeah, absolutely.
And that went against him,
Yeah.
unfortunately.
Yeah, and I would say what I always tell people that program coordinators are perhaps the most important people
Yeah.
because even as chief residents, program directors, they all depend on them for a lot of things.
Yes.
And those people should be the last person you should offend in any way.
Exactly. And they work a lot. They have a
Oh,
lot of job. And they're coordinating everything together. And if they don't get the due respect they should, it's not good. And I also told them, like, maybe English is not your first language, but please practice before the interview.
absolutely.
Know what words should come out of your mouth, and are they rude, or are they considered rude in any society or any other place? They may not sound rude to you, but they may sound unprofessional or rude to other people. And these are small things. When I talk about red flags, it's not like red flags that you failed,
Hmm.
because if you fail, you're going to explain to me. Either everybody has an answer, or
Hmm.
if something bad happened, you can explain. But these things, there's no explanation. That why were you rude with the manager? Why didn't you
Ab-
wear a tie? Why were
Absolutely.
you so casual?
Absolutely. Makes a lot of sense. Dr. Lahi, we'll try to wrap up. I have a few more questions. So one question is that let's say there is an applicant, an IMG, who has a green card but graduated 10, 15 years ago, has done exams, may have one attempt, but have been trying to stay clinically relevant, maybe doing some research job. What would be your suggestion to those people that how should they make themselves a good applicant for any residency, internal medicine residency
So there are too many applicants like that,
program?
and you have to do something extra to shine.
Hmm.
If I were in their position, I'll do good publications
Hmm.
and I will highlight them. And I can even personally send email to the program director, or find time to meet them in an area where you live, so
Hmm.
that we prefer people who will stay local.
Ab-
If somebody is here, I will prefer them, because we want this valley to have more doctors. And this is true for most of the programs in US too, that they want to build their own practice in that area.
Mhm.
So they should have good publications, stay active, and then obviously approach on the side, because your application may be filtered on the first attempt.
Mhm.
I will filter, because I have 2,000 applicants, I'm going to filter more than 5 years. But if I have something on the side that, hey, this guy has done this publication, he
Mhm.
was in American College of Cardiology
Mhm.
conference, he was there, I met him there. That's something you should do.
Okay, absolutely. Uh, Second last question is that if an applicant, of course, in addition to signaling, there was a time when people were sending what they called the email of interest, where they would write a professional email just mentioning about their interest in the program. Now, is that something that, especially for your program, they can still do? And what's your take on that?
I think it's important, because if you don't do it, uh, unless you're a very good applicant, that's good. But if you don't do it, it gives me like a signal that you're not interested. So
Mm.
after an interview, I think your program director, whoever, deserves an email if
Okay.
you are interested.
Absolutely. And how about people who are interested in getting interviewed? Can sending something like that prior to, let's say, after they apply to your program, would that make any difference at all?
It it will not, but it can. The reason being is because there will be too many emails
Hmm.
which will not be, like, read in time. But it may, because if I go through an email and I see something good, if
Hmm.
something is good about you, I don't want to miss it.
I
That's my goal. I will go through everything I can, which is humanly possible.
hmm.
But if you keep on repeating the same email again and again, you may go into the ignored list. So it
Absolutely.
should be short, and like should have all the information,
Mhm.
and definitely it should be important.
Okay, absolutely. My last question of the day would be that everyone who's listening, AMGs, IMGs, especially IMGs from Pakistan, India, Bangladesh, Nepal, what would be your message? Because the match season is upon us. What would be your message for them?
My message would be just, to me, your scores don't matter a lot. Okay. If you have an attempt, you can justify it. You should have a reason, and then you should do something extra to cover it up. Do some research, do some extra activities like some ultrasound courses, some anesthesia courses, whatever you can find in your own country. And then prepare for your interview, please. It's very important. That's the time you're going to be deciding, or are we going to be deciding if you're coming in or not. And it should have like all the professional appearance and all the like all your efforts should be on that day.
Okay. All right. So thanks a lot, Dr. Elahi. You took time out of your Sunday, and I would hope and I would request that in the future we can do similar ventures again.
So thank you. Happy to help.
Thank you so much.
Thank you.